Hi everyone, Nasaya here with Nuvia Dental Implant Centers. This week we sat down with Dr. Sherman, Dr. Hepworth, and Dr. Hansen to talk a little bit more about our Safe Smile method. The Safe Smile method includes these points. Number 1, perfect planning. Number 2, a built-in second opinion. Number 3, safe sedation. Number 4, rapid site recovery. And number 5, true integration.
Planning for surgery begins with meeting a patient and seeing what's going on in their mouth, the condition of their teeth, their smile, their gums, the soft tissues as well as the hard. And then integrating that with CT imaging. So taking a CT scan. After meeting a patient, we can then look at their CT scan and not only just have access to those images, but we have software that allows us to interact with that data, interact with those images, place implants virtually, implants in where we think we would like them to be, and really get a good idea of the site-specific environment where an implant might be and if it will do well there, if there's enough bone, if the bone is dense enough to really almost perform surgery virtually before we actually perform it with the patient present.
Probably my favorite of the Safe Smile method is the built-in second consult, which is collaborating with another doctor. Because what's interesting about dentistry is there's not necessarily one way to do it. There's always different approaches or different angles, different options that patients have. So to be able to collaborate with other dental providers and figure out what's going to work best for that patient, it's always exciting to figure out what's going to be best for them. Having an anesthesiologist in the room makes a huge difference for me as a surgeon. Previously, doing the IV sedation as well as the surgery, we're focusing on the patient's vitals and making sure that they're comfortable, while at the same time trying to perform a complicated dental procedure isn't what's best for the patient. And so to be able to have one person focus on the sedation and keep the patient completely comfortable and then have the surgeon focus on the surgery really gives us the best result when we're working together.
So one of the things that sets Nuvia apart certainly is advanced concepts, advanced scientific principles in our oral surgery and our bone grafting and dental implant placement. One of those is the use of something called platelet-rich fibrin, or PRF as we frequently refer to it. This is an exciting thing that's been around for a handful of years now and being used more and more. The idea is to use what already exists in the patient's own blood to heal a wound, to regrow tissue, soft and hard tissues. That capability really exists already in each of us, and through the use of concentrating important things that are in your blood, things like platelets and things like immune cells and different proteins that help with tissue regeneration, concentrating those and using them in any given place, whether it's in an implant site or bone grafting, a bone regeneration site. We're really putting into those areas more of those healing components than you could naturally get there on your own. And so we not only see better results with the use of those, we see improved healing, we see less pain, we even sometimes see less swelling, and the speed of recovery as well is increased. One of the best things on top of that is patients tend to need less strong pain medicine than they would otherwise, which is a huge win for all of us right now.
True integration is when we're totally confident that the implant has integrated and healed completely in the bone. So once you first put in it, you imagine a screw into your bone, it's mechanically held in there. But with time, after a couple months, the bone will grow up into those threads and it's not coming out. Implants are made of titanium. It's a biomaterial. The bone will cling onto it and grow around it, and it becomes rock solid on there. In order to test that, we have a little tool that sends vibrations down the implant and gives us a numeric value.